Bell's palsy can be a scary and frustrating condition to have, but there are things you can do to slowly regain movement and sensation in the face. I'm Allison Wu, Doctor of Physical Therapy and Certified Neurologic Clinical Specialist. I specialize in working with patients with neurological conditions such as Bell's palsy. We recently posted a video that demonstrates a sample progression for slowly regaining muscle movement in the face. Today, I'll be sharing part 2 to that video. If you have not watched our first one, try that first. You can find the link in the description box below. To follow up on the first Bell's palsy video, let's talk about facial synkinesis. Facial synkinesis is the involuntary discoordination of facial muscles caused by abnormal regrowth of facial nerves from either facial paralysis or delayed recovery of facial nerve function, usually 2 to 3 months after the initial occurrence. There are several causes. Please refer to an MD, ENT, ear, nose, throat, or otolaryngologist who specializes in working with patients with facial paralysis for diagnosis and collaboration in your recovery. We need a teamwork effort here. Today, I'm going to focus on some techniques you can do to mobilize and try to retrain your own facial muscles. First thing first, it will be helpful if you have a video of your face to determine what kind of abnormal movements happen. It's really hard to do it by feel. For example, does your eye close without control when you intentionally chew, swallow, and/or smile? Does one side of your mouth smile or nose scrunches up out of control when you intentionally close your eyes? When you smile, do your neck muscles on one side tighten? Try videotaping yourself eating or have someone else do it and laughing, smiling to compare and contrast, because that will give you a better idea of specifically what to do for your face. I'm going to show a combination of mobilizing and retraining. First, the mouth. We will have a follow-up video on eye because there's a lot to do here. If your smile can't rise like your other side, one side droops, and/or pulls to the strong side off center, it's important to assess the flexibility of your cheek and lower lip. So for example, if you smile and both sides don't go up, maybe kind of like this, or it actually pulls to the strong side, like the whole entire lips pull that way. Now, if this side does not go up, let's say my right side is affected. Let's think about which muscles might be tight, the bottom or the top. Since this doesn't rise up normally and it sits down here, then the bottom may be tight. Now, wash your hands and you'll want to stick your fingers actually in your mouth to assess the tissue. So you want to go inside your mouth and pull in different directions, and I will show you. Up this way, towards middle, and towards middle. And see if this, when you pull, actually pulls into your neck. Now, you must compare to the other side. So check the other side. Do this slowly so you can get an idea and feel for how tight this pull goes from the chin, the facial, down into the muscles. After prolonged paralysis, the strong side will have worked far more than the weak side, and it also may be stiff, which is why you want to check this side. If anything, these muscles might be really tight. Check the strong side. Check the weak side. Now on the weak side, if you find a degree of stiffness, you'll want to pull on it for 15-20 seconds, about 3 to 5 times. Okay? And pull the strong side that's really tight right here. Release that too. Now do this gently. Feel the tissue stretch and lengthen. Don't just yank and pull. If it is numb, you might want to do this in front of a mirror so you're not causing any sort of damage with excessive pulling. After you've released these muscles, now what you want to try to do is retrain the muscles. I have a little meridian tool here, and it creates a little electric zap to the muscles I want to use. Now, the most important thing is you have to use this with ultrasound gel so that it's a specific localized little spot right here that you're going to work on. So the muscles I want to help my smile are these ones up in this direction. So I'm going to turn this on. I don't have gel today, but please use gel at home. Another tool you can use is called a Z-Vibe tool. It's like a little pen with a vibration tip. The focus of this is not necessarily to electrical stimulate these muscles. You're just trying to give some feedback so your brain has an idea of which muscles you need to use to create your smile. So I'm retouching this, and I want to try to use these muscles right here to try to smile. You can even help the muscles a little bit with your other hand. Okay, and these muscles right here. You can even try imagining using imagery and try to use the weak side only. And just use your fingers to draw up the cheek muscles as you're giving a little tap, tap, tap feedback to draw it up. If you feel both sides of your smile as you're trying to do this, but the strong side is so strong as pulling everything over to the strong side, try maybe smiling with one side of your face. Imagine the motion, use a mirror, use your fingers to try to draw it up first to help you, and your little zap, zap, zap tool or vibration tool to give a little feedback for your brain to figure out which muscles I need to use. Try to hold this also for 10 to 15 seconds. Now, the challenge here is use a mirror to not use your eyes, not use your neck, and use anything else but your little smile muscles, which is where your hand comes in to give it a little bit help and a little feedback right here to wake it up, and use that weak side only. As you try to wake up your smile muscles, try not to use your nose either, because sometimes people might scrunch and do this whole thing with the eye and the nose and the mouth. If it doesn't move, don't force it. Don't compensate and build bad habits. Use imagery, imagine the motion, and don't hurry the process. Nerve regeneration only happens 1 millimeter a day. Give it time. Some people will want to know if they can use electrical stimulation with the gel pads. I would tend to not recommend that because a gel pad stimulates too many muscles at once and creates poor habits and activation of too many muscles. Want you to try to focus and isolate and target your specific muscles, which ones you want to use. Google the anatomy of these muscles right here to figure out which ones you're touching. In general, is all about right here to help you smile. If there is no nerve talking to the muscle, this does not help the nerve regenerate to be zapping your whole face. If your smile rises with your eye closing, assess and treat these muscles to see if they are tight from being overactive. So when you close your eyes, then this kind of climbs upward. This would be best seen with the video that you had taken. Sometimes when the eyes close, it squinches up, or does it squinch up with and then your eyes close? We have muscles up here on the upper lip, up into our nose, that are overactive altogether. So again, go inside your lip and see how tight it is. Right next to the nose, a little bit next to it, towards the cheek, pulling out a diagonal, even out into the cheek, out in that diagonal. Okay, and compare your other side. If it's tight, go in. You can even massage a little bit as you're pulling. Okay. If your nose scrunches up with it, You can check right next to your nose. These muscles right here that line the side of your nose. You can use your nostril and pull down and feel how tight this is. Again, do this in front of a mirror if your sensation is impaired. And here, compared to this side. Now, if it is tight, then you want to hold it. You can draw it upward a little bit and lengthen the tissues. Be kind, nice and slow, control. All the way up. And all the way up. And all the way up. Okay. And see if you can hold your lip now while you blink. Now we go into retraining. Since your eyes close and you draw it upward intentionally, see if you can use your little tool to activate these muscles as you blink to try to turn off use of this. These two need to balance each other. Or you can also take your finger and pull it down as you're blinking. So pull it down while you're blinking to retrain. What you can do is keep your eyes closed for 10-15 seconds while you're pulling to feel if this is turning on or can it stay off. Do that 5 times, then take your hand out of your mouth and gently touch your face and see if this can stay off while you're closing your eye. What we can do next, since closing your eye initially caused all this to scrunch up, is to try to retrain it. Once you've lengthened the nose, you can focus on nose depression, nose flaring, nose depression, 10 to 15 seconds, and see if you can do this without your eye and without your lips, without the smile. Nose depression, 10 to 15 seconds. Now here, naturally wants to draw this in. Okay, you can try scrunching a little bit. Your eyes will come in a little bit. That's okay, just so long as you don't clench. 10 to 15 seconds. Nose depression, 10 to 15 seconds. Nose elevation, 10 to 15 seconds. Eyes open and eyes closed. These exercises work on the coordination, timing, and control of the nerves to the muscles in your face to help you regain use of them. Let us know your thoughts on our video and leave us some love or questions in the comments box below. We'd like to add additional videos to follow up on this topic. Please like and subscribe. We appreciate the support. I'm Dr. Wu. Remember, we heal smarter, not harder.